So you threw your back out. Maybe it was a 500-pound deadlift, or maybe you were just picking up the dog bowl. You felt it and all of a sudden you're on the floor. You may just have pain in the low back, it may be running down the leg, or you may even have a side shift to where you're having difficulty even walking. Anytime we're dealing with discs and nerve pain, it can be really scary, but 99.9% of the time we can take care of these conservatively. In our office, we're going to take you through a full exam to make sure we know exactly what we're dealing with, and then we're going to take a look at all of the joints of the surrounding areas. All of the treatments that we do are going to be to try to decompress this area. So this may be a chiropractic adjustment, or it may be a soft mobilization to make sure that we are making all those joints move the way they should. We're going to follow that up by taking care of all the soft tissue that is tight and angry and holding on for dear life to try to keep you safe. And generally, we're going to end up on the decompression table, which is going to open up the joint space, give that nerve root a little bit more room, and create a reverse vacuum effect to pull everything back to where it needs to be so the outer layers of that disc can heal. But the most important thing we're going to do with this is going to be exercise. We're going to give you some exercises to make sure that we stabilize that low back so that we don't keep irritating it over and over again. This is going to look a little bit different than your general low back pain. So let's go ahead and take a look at some of that. Now, when we're dealing with disc injuries, one of the things we're looking for on the exam is something we call a directional preference. We're looking for the range of motion that will help to, one, reduce your pain, or two, the big thing we're looking for is to centralize that. So if we're having numbness or pain that's going all the way down your leg, and I can move it into the knee or into the hip by doing a certain movement in a certain direction, that's going to be your directional preference. And everything we do from here on out is working towards centralizing that. So let's say extension was the motion that does that for you. I may start someone just on their stomach in this position, and we're just going to hang out here for a little while. That could be the option number one when it comes to these exercises. As we get stronger, you're going to work on pushing yourself further up into that extension, holding for around a second, coming back down. And we're going to rinse and repeat this motion. And this is really going to be your best friend for the next week or so. And a lot of times that's the positions that we'll start with a disc patient. We'll build into more strength work as we get better, but you have to be very careful when you're dealing with nerve pain that you don't do too much too fast. That's very important for a disc, that we are tailoring your exercises based off of your exam. You have to be more careful when you're dealing with a disc patient than just a general low back patient. So go ahead and get on our schedule so that we can go through a full exam, tailor this treatment to you, and get you back to living life without fear of moving and without re-injuring yourself.